The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Kim Thorne Motors, Kiko Auctioneers, and, of course, our technical producer, J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist, and our special guest, Jonas Sykes, Director of Physical Therapy, and Jeannie Lee, Certified Lymphedema. They get it right, a therapist and occupational therapy assistant at the Aultman Lymphedema Management Clinic. Thank you both for joining us this morning.
Thank you.
Yeah, thank you for having us.
Up to 10 million Americans and hundreds of millions of people worldwide suffer from lymphedema and other lymphatic disorders. In the United States, that's more people than are diagnosed with multiple sclerosis, muscular dystrophy, ALS, Parkinson's disease, and AIDS combined. Both children and adults, males and females, can develop lymphatic conditions, but it often goes undiagnosed until the symptoms have progressed to the point that lymphedema is very difficult to treat and hospitalization is frequent due to infections and wounds. March is Lymphedema Awareness Month, and we're here with Anna, and we're here today to learn about this condition and how it can be treated. I'd like to remind our listeners today that our broadcast is also available on our podcast, which can be downloaded from the App Store and on your smartphone, so you can take the program with you wherever you go. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any program anytime. If you've got questions, you can give us a call today at 330-450-1480, or you can post them up on our Facebook feed.
So, Jonas and Jeannie, tell us a little bit about yourselves and your roles at Aultman.
I've been a physical therapist at Aultman for the last 18 years, and I'm currently, as you mentioned, the Director of Hospital Therapy Services, and I have the privilege of working with our lymphedema management team with Jeannie and Anna and Kim.
And good morning.
You?
Yes, I've been an occupational therapy assistant now for about 20 years. I've been with Aultman for over 18, and I was certified with a lymphedema therapy in September 2012 at the Norton School of Lymphatic Therapy.
Interesting. Okay, so where is Aultman's Lymphedema Management Clinic?
Yes, we're located in the main building of the hospital on the ground floor. Conveniently, we're part of the wound care clinic. With our patients, wounds can be a big problem, and they often already are seeing the wound care team, so we just partner with them while the patient is getting both treatments.
So what is lymphedema?
So, lymphedema is an abnormal buildup of protein and water in the skin where the lymph system isn't doing its job properly. We always stress that this is not protein that we eat. So we don't want patients to reduce their protein in their diet. However, this is a protein that is a waste product of the skin, of the cells, in the skin. Your lymph system works like a sewer and should carry that protein away, but if it's damaged in some way, it doesn't, and the sewer becomes backed up or congested and overflows into the surrounding areas, which are your skin. This is when you begin to see swelling made of protein and water. It's very hard to get it out of the skin because the protein and water are bonded together and don't want to move out of the skin. So, for example, typical people think for a lot of swelling that diuretics can be used, where lymphedema is a different type of swelling.
Why would I get this?
So, you believe it or not, it can occur with multiple injuries or surgeries. As far as people that have had mastectomies with lymph node dissection, and people can be born with impaired lymphatic system. It's just multiple things that can go on.
So would I just get this in certain spots of the body or all over the body, or would I?
Well, it can be in all areas of the body. However, we typically see it more in the arms and legs, sometimes in the abdomen, trunk area, and the back.
What's it look like? I mean, topically, what would I see?
You would see more just a swollen limb, like with ladies, we will in their arms and hands very swollen compared to obviously their unaffected arm, and people with the feet, they're difficult time fitting in their shoes and very swollen limb.
So this is not like other kinds of swelling, or is it?
It
Okay, so you bang your arm or something and it gets swollen or whatever.
Correct. In that swelling typically in time will dissipate, but where lymphedema, it's not going away, and it'll just continually can get more swollen and get worse in time, and where the skin can harden, and there's just multiple things, and infections, of course, can occur as well.
So I can't fix it. Can I fix it?
Well, it's not curable. However, our treatment plan, we definitely have things that we utilize and everything to help you to be in control of it versus it controlling you.
Okay, there's numerous layers of skin, correct? Okay, as I recall from my university day, like 3, 4, whatever.
Yes.
Where's the swelling? Underneath all of it?
It's in the interstitial space, so it's more superficial still, but definitely it's like people think it's not deep where like muscles, it's more above that surface. So it's
to the point where sometimes it'll even, with some of the patients that get wounds, it'll actually seep through the skin, and you'll have fluid that seeps out, from the swelling.
Correct.
So the lymphatic system, though, it's not like your veins and arteries, but it goes throughout your entire body, right?
Correct.
So
yes.
it's kind of like a separate
flow. It cleans out all
Okay.
of the things, impurities per se, and then it'll go back into the circulatory system, and obviously also excreting in the waste system as well.
Well, is that area of the skin, is it red? Is it hurt if I touch it, or?
Well, typically, now patients that don't have infections, it's not typically red, but obviously redness would indicate infection. But typically patients are more swollen, they're tender, they feel like their arms or legs are heavy. And it's usually not painful, but it can be numb or tingling.
So what other symptoms? Is it generalized malaise, or what else? Would I be in pain? Would I?
Sometimes pain can result, but more frequently patients are just like, it's just very uncomfortable. It's very tight. I feel so it's heavy. But then, of course, if you think about it, your arm is heavy and it's pulling down from your shoulder joint. You can typically get more pain from the other resulting areas because of the heaviness.
I have a question that I don't know if it's relevant, but when you were a kid and your mother said you had swollen glands, is this the same kind of gland?
The lymph nodes?
So that was your lymph nodes?
Yes.
So we're just talking about it could be anywhere?
Correct.
Okay.
Correct.
So if we've had like chemotherapy, because of cancer or whatever, would we be prone to this?
You definitely can be prone for it. However, we're not obviously every patient, but yes, that definitely puts you more in the area where you could possibly see the lymphedema occur.
But the skin is not open.
Generally, and unless like it gets to the wound and infection stage, of course, then yes, it can be opened.
What about this disorder as life-threatening?
Well, it's not life-threatening. However, like we talked about, this infections and turn into cellulitis, and cellulitis can definitely be a deadly, unfortunately, for patients. And we luckily not had that occur with our patients, but it's certainly. I don't say lymphedema is deadly, but there's certainly complications from lymphedema.
And I think, too, with the prevention focus that healthcare has now, lymphedema, because it can lead to other things, whereas our lymphedema clinic can take care of it, it can prevent those things like infections and some of those things that will happen if it's left untreated.
Can we treat this with antibiotics, or what do we do with it?
Well, certainly with the infections, the doctors will prescribe the antibiotics. However, we do a treatment. It's called the CDT, which means complete decongestive therapy, and we consider that our gold standard. Basically, we consist of manual lymph drainage, which is like a very soft massage, and also it stimulates the lymphatic flow from that swollen area. And then we will follow up with bandaging, which is very bulky, and however now we have this game changer per se for these patients where we use a neoprene type of garment material that provides outside compression, and then in turn it's where we have the patients come in and it's adjustable, and every patient treatment we do will decrease it, and it also decreases the size.
Can we cure it?
So it's not curable, but again, we just we have patients, we teach them to keep it in control and to maintain it and their decreased lymph size. And so that way they feel like they can live a functioning life and not be debilitated with this disease.
Other problems with the disease? Are there other? I mean, we've talked about a couple maybe. But.
Well, the biggest frustration, obviously, just the common things for patients complain of, and their clothes not fitting, their shoes not fitting. We had a patient that literally had to buy 2 pairs of jeans to have his seamstress sew them together.
Put them together. Oh, my God.
Yes. It's just very, you go out and your one side is larger or both legs. It's for appearance, it's very humbling, for these patients to be in public.
The amount it can impact their mobility is unbelievable, because you figure if you tack some people like 30 pounds on one of your legs, how much more difficult that is to move.
Sure.
It's amazing how much it impacts their mobility, and then after they're treated, how much better their mobility gets is amazing.
Mm-hmm.
So that's why in our shoe department we find boxes of shoes with 2 different sizes of.
Probably, for sure. Yes.
It does happen occasionally. I mean, we don't sell shoes. We have boots and stuff like that in one of our stores, and it does happen every once in a while. So you'll find a box that has 2 different sizes of boots in them, and we saw now. I know. What are the reasons?
Yes.
All right, I tell you what. I think we'll take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshoprx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
That's right. This is Paul White, and the Half Off on Hot Buy store is your cold weather source. Women's Winter Tech gear boots are only $6.95. Fashion boots are marked down to $9.99. Retail value up to $60. And hats and gloves are on sale, too. New in the store are American greeting cards. 2 for 99 cents. Regular price at $4 each. Also, for snow shovels to floor mats, stop in the Half Off on Hot Buy store. Find the best deals in town.
Hi, this is JP, and I'm here with my grandpa talking about the amazing deals at the Half Off and Hot Buy store in Louisville. Visit our website at halfoffhotbuys.com and check us out on Facebook, too.
Hi, this is Brad White from the Medicine Center Pharmacy. Do you feel stressed and tired? Do you rely on caffeine, crave salty snacks, have mid-afternoon lows, and can't bounce back? These may be signs of adrenal fatigue. The Medicine Center Pharmacy offers easy saliva cortisol testing and nutritional supplements to help you get your energy back. Talk to your Medicine Center pharmacist and see if cortisol testing is right for you. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we are joined by Jonas Sykes, Physical Therapy Director, and Jeannie Lee. It is Jeannie, not Janine, Jeannie.
Jeannie, yes, sir.
Yes. Certified lymphedema therapist and occupational therapy assistant at the Aultman Lymphedema Management Clinic. Have a question? Give us a call at 330-450-1480 or post your question on our live Facebook feed.
Okay, what about risks? Who's at risk for getting lymphedema?
So people can be born with lymphedema. It may not show up immediately at birth. However, their lymph system can be malformed, and they may start to have swelling at puberty, or for women, it can be occurring after their first child. But the majority of the people with lymphedema is because something happened to damage the lymph system. So this could be a surgery like a mastectomy with lymph node dissection, radiation therapy, an accident, obesity, severe venous insufficiency, or lipedema.
Okay. Then I have to ask the next question that I'm thinking of then. So if you have surgery, are you guaranteed to get lymphedema, or is it just a complication that could happen?
A complication that could happen, and certainly you will have the swelling residual after surgery, but if your lymphatic system is normally functioning, it will take time, but yes, that should resolve. However, patients with lymphedema, certainly that can be like a jump start to, sometimes we've had knee surgery patients that then they've noticed their swelling, it doesn't ever go away. So then maybe their lymph system is like, okay, I've done enough for you. After this surgery, I'm done, you know?
So is it related to how many lymph nodes they remove? I mean, we've got them all over the place, okay?
Right. It's really hard. I wish there was a easier way, yes, if you have this many, but it just is random. Some people really have a lot more removed, and we don't see any swelling in occurrence with lymphedema. Then others have just a few, and then we see more. It's really interesting.
All right.
I categorize this as sort of an unknown disorder. I mean, I don't think I've ever heard of this. Have you?
Lymphedema.
Yeah, I have, and I guess when you mention in the beginning that it's difficult to diagnose, I'm thinking about, how stubborn we humans can be. You bump your arm or something, and you think, I'm a little sore, it'll be fine, and then a month later or 2 months later, it's still there. And then you mentioned that if you've got all kinds of swelling, it's even harder to treat. So what's a diagnostic path? I mean, are there lymphedema specialists? So do you go to your regular doctor, and if they have trouble, do they refer you? Are there signs they can look for?
Well, typically the patients, obviously will talk to their doctors about this swelling that's not going away, and then the doctors, hopefully as they're finding out more about our clinic, they'll be sending the referral to us. There are a few lymphedema specialist doctors that we're aware of that's in Cleveland Clinic. So
no, there's really no cure for this. I mean,
no,
other than palliative
to learn, to have for the patients to learn to get this in control for themselves and learn to manage ways to keep their swelling in check, per se, but yes, as far as curing, unfortunately, no, but
well, are these people able to be gainfully employed or?
Sure. We had a gentleman that did great, and he's consider him kind of like our poster child for our program. He was very compliant, and he lost actually about 60 pounds of fluid and was able to return to work part-time. And, for the first time, he could go swimming in the summer. He went on vacation. He wore shorts.
Wow.
And, and he made other life choice changes. So it really was like a jump start to a lot of other good things going on in his life.
So what are the aggravators of this disorder? Smoking, alcohol, all the other stuff that's out there that aggravates every other disease.
Well, some patients, obesity plays a part. Patients that sit for long periods of time. We have had truck driver patients, because if you think about it, you're sitting, you're pinching off your inguinal lymph nodes. There's just a lot of obviously the surgeries, and ladies with older mastectomy surgeries, they can be great. And then we had a patient 20 years later, she was pulling weeds, and all of a sudden next morning she kind of felt like, I maybe pulled a muscle, then her lymphedema, swelling occurred in her arm.
And then sometimes is flying, you tell the patients too?
Yes, flying can definitely, different elevation, the cap and pressure. It's just, It's so per se can be random, but yes, we in our clinic, as far as we also are doing health education talks, and we're talking about risk and do's and don'ts for lymphedema or precautions and things like that as well.
We've done this radio program for a long time, 7 or 8 years. Some of this stuff, after all this time and all the disorders we've talked about and all the doctors and healthcare people we've talked about, I wonder why I don't have that. Yeah. I mean, it's just, or something, that was brought to the table by many of the subjects we've used over the years. What would be the percentage of population has this? Do you have any idea?
We know more whole numbers, like you kind of mentioned in the beginning, up to 10 million Americans, they believe, could have it, and worldwide, obviously quite a bit more than hundreds of millions they would believe would have it.
10 million Americans, that's about, what would that be? That'd be less than 5%, wouldn't it? Can't do that quick a minute.
I don't have to get my calculator out.
Well, 370, let's say there's 350 million people in America, so...
10 million people that don't want it, though.
Yeah,
right,
for sure. Wow, how interesting.
So let's talk about some treatments. We've highlighted some things a little bit earlier, but for listeners just joining us, let's talk about treatments available at the clinic, and then we can talk about the therapy that can go along with that, too. So can we do that?
Sure. So our certified lymphedema therapists that do the evaluations, Kim or Anna, they would have the patient come in and obviously look at their symptoms and talk over their health history and go over, they would take measurements, see whether swelling compared to their unaffected side or both if they do, and then they decide a treatment plan that's individualized with that patient. Because of course that patient has to want to do what we are suggesting, and it has to be individualized to that patient so they can partake in the treatment and be successful. And then ideally, if the patient decides to do treatment, then I usually do the treatments, and there's a manual lymphatic drainage massage, like I said, that stimulates the flow. And then afterwards, we follow up with a garment, the compression garment, that does a reduction garment, we're calling it. And then once the swelling, or say after, it just depends on the time frame, but after the limb is reducing, then we would follow up with a daytime garment.
So when you talk about a compression garment, just on the area or the whole body?
Just on the area, and like we said about, it could be in the trunk. So there's other type of garments, compression, capri garments, and different things like that. But definitely, obviously, has to be on the area with the swelling.
Okay.
Like you've talked about whether there's a cure. There's really definitely two stages where they're getting the swelling out, and then there's almost the maintenance stage where those garments are coming in and saying that will keep them where they're at as long as you continue to wear the garments.
So it's generally localized, is that what we're saying? It's not total body?
In some cases, people, we've seen more the majority with either both legs or one arm, but it certainly can be whole body, all extremities, and in that case, unfortunately.
Okay. It's the bottom of the hour. Time for the news. Thanks for listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
This winter and shop the largest auto mall in Northeast Ohio with one click at KempThorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz, there's something for every price range. And KempThorne.com makes shopping easy, fun, and friendly. Less than stellar credit? Never a problem. And we have a huge selection of pre-owns. Kempthorne is a name you know and trust. They've been committed to our community for over 80 years. Shop KempThorne.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we are joined by Jonas Sykes, Physical Therapy Director, and Jeannie Lee, Certified Lymphedema Therapist and Occupational Therapy Assistant at Aultman Lymphedema Management Clinic. Got a lot more to cover this morning, so let's get back to the show, but I got a little commercial for you. So, you don't want to miss the upcoming Kiko auction March 7th with auctioneer Bill Gill Jr. from the estate of Robert Ciccone. There will be collectibles including old books, advertising signs, firearms, fishing tackle, military items, old toys, tools, sports cards, paintings, furniture, antiques, and more. Mark your calendar for this Wednesday, March 7th at 3 p.m. at 3201 Parkway Street, Northwest in Canton. Call Bill Gill Jr. at 330-418-8727 or visit KikoAuctions.com for pictures, directions, and more information.
All right, sometimes when we have a subject on the air that is kind of like yours, that maybe listeners have a hard time grasping, if you will, I try to think about things as if I was the patient. And the only analogy I can give you is I was thinking about my physical therapy with when I tore an ACL. And, you know, you've got visits on a weekly basis, multiple visits, and, you know, you want to be better right now, but you can't be better right now. It takes repeated time. It takes putting in a little effort. It takes that persistence. And I'm thinking about patients with conditions like this lymphedema, whether it be an arm or especially a leg, and you've mentioned patients that have difficulty with mobility. Yes. Maybe could you walk us through a garden variety? Let's say I came in and I was diagnosed with lymphedema, and I had it in the leg, and my leg was swollen, so I had difficulty walking. And especially, you know, it's winter, so we've got ice, and I can only imagine that level of complication.
Sure.
What do you, if that was my problem, what do you do for the patient? Where do you start? Is that a fair question so that we can maybe get an idea of what a patient goes through and how and what's important in your therapy process at the clinic?
Sure. So an evaluation would be completed, and then we would discuss with you, okay, so here are your options, and would you like to reduce your swelling? And I'm assuming yes, you would. And then we would measure you for, like I talked about, these reduction garments. We would get those ordered, and then we would have you come back for treatment and start treatment where we would start placing these garments on. And also, like I said, too, with the manual lymphatic drainage. And then also there's education. There's a specific home exercise program we'd be going over with you, and self manual lymph drainage that we teach you as well.
Are simple, like, okay, so let's say it's a leg. Simple things like elevating the leg, is that helpful? I'm thinking, you get you get swelling around your ankles. Maybe it's a different type of swelling, but I'm just thinking of maybe helping gravity not work against you in that case. Is that something that's relevant?
Well, we certainly tell patients, elevation, if it's comfortable for you, it's more comfortable to you to elevate, certainly do that. But however, that's not going to reduce your lymphedema if that's indeed what you have.
Okay.
Certainly you will need outside compression.
And that's a good thing. We talked before about what's the difference between lymphedema and just regular swelling. As where regular swelling, you would elevate your leg and you would see it reduce, but because the lymphedema is trapped with that, because it binds with that protein in your skin, it won't reduce when you elevate it usually.
Right.
But when you use these manual lymph drainage with the very light massage, and then the compression garments, that actually gets it out for the lymphedema. So it's a little different than your regular run-of-the-mill.
Interesting.
So
Okay.
back up a second. With the compression garments, you're just moving the swelling around?
Well, the manual lymph drainage, which is basically a very, very light massage, that will move the lymphedema around, and the compression is
a follow-up
a
for
follow-up.
that. Yes, and so the massage will definitely get the lymphatic flow. Then we would follow up by putting the garment on, and then we generally see the patients 3 times a week, like Monday, Wednesday, Friday, and then as they come in, and we'll have them take off the garments, and then we'll do the manual lymph drainage, and also then follow up with the reduction garment.
So where does the protein swelling go?
So it gets reabsorbed
In the body, through the
Yes,
body,
and through the body.
and exits the body.
Yes, exits
Okay.
as well.
So what we've got going here is just a constant buildup of protein swelling.
Right. It's like a congestion, like we tell our patients, in the sewer system, everything's backed up. It's just stagnant. It's
And
just
you
not
say
moving.
stop eating protein doesn't work.
No, it doesn't. It's a different type of protein.
Okay.
It's a waste in the blood, the
Okay.
cells. Yes.
Would any dietary changes be of value?
Well, in our course, that we went to, they definitely recommended following the more Mediterranean diet, being, obviously more healthy foods, reduce on salt products, of course, and, follow and drink. Obviously, do not stop drinking water. You need to. Yes, you need
What
to
about
water
alcohol,
your system.
smoking, and all that kind of stuff?
Well, that certainly would not help this, just in any other any other conditions that the patients have as well. It certainly would be helpful if the patient would lay off.
What about a vigorous exercise program?
Definitely we definitely give them a specialized home exercise program, and then some of the patients, like swimming is a great exercise for patients.
You see.
And they'll like to go to the gym. As they become more mobile, then they can follow up with the our outpatient.
Interesting.
gyms.
Okay. I was just thinking about the compression stockings, and the first thing that comes to my mind is knee-high and thigh-high stockings for people that have different types of issues with circulation in their legs. And I guess I never really thought about the extent that you could have problems in other parts of the body. So at least for me as a pharmacist, this has been interesting. So to be aware of other needs people might have that may not be widespread, because I'm guessing it isn't the easiest solution to help people find. So we definitely need to do some research on that. I was just looking here, and I see there's different manufacturers that have all kinds of different combinations, and it's really interesting to see how they solve problems around shoulders and upper arms and things like that. So it's very interesting.
Yes.
So
It's a big play on this kinesiology tape. Is that what you guys used to use?
They used non-elastic wraps, so it wasn't kinesio tape per se. It was something different than that. But
Right. It was a Comprelon. It was a two-way stretch versus people think like ACE bandages.
Oh, I see.
It's a different type. It's a two-way stretch. So ACE bandages gives more at rest and activity gives the same, whereas two-way lets off during.
Would you say there's a lot of people that are misdiagnosed? Or that aren't diagnosed? Or
I would say probably aren't diagnosed more
Yeah.
so. The patient's doctors just want to typically say, okay, the diuretic or do other, possibly some procedures that it will not help that lymphedema, and then they'll come to the lymphedema diagnosis.
Interesting. Where are we at, Brad?
Well, we ought to talk about other treatment options. We had a caller call in and wanted to talk about external types of pumps that can help with treatment. Do you want to talk about those?
Sure. I mean, it's definitely alternatives, and obviously in our training it was not ideal, but there's different manufacturers, much different machines now, and we, if patients don't decide to use that, then in this case we have other tools per se in their toolbox that we can get them. We have 2 very good companies that we consult with for the pneumatic compression pumps when appropriate.
And we've had some good luck with some of the patients, and some of the patients that we've tried the traditional treatment and they couldn't tolerate it. They've definitely had some success with the pumps when that option's the best.
How do they work?
So they're like a sequential. So they start. Sequential starts at the distal part of the limb, and
so like down at the foot or out at the hand.
Right, but there's other components as well now that, like I said, the more better pump systems that are out there that are.
So is it like a blood pressure cuff or what?
A really big one.
I mean, it's, so to speak, I guess to think of it that way. It's sequential, and it goes up the limb, and then it's...
So like in a wave? Is
per se, yes.
Yeah. Okay.
Yes, a good description. Yes, and then, patients wear them about an hour at a time. So again, if time factor, some patients like, I can do that, or no, I can't do that.
Is it painful or?
Generally, the patients, it's more comforting, and they really enjoy that.
Okay.
And that the one
very light pressure.
And the new one that you had said has a lot of different compartments in it, right?
Right. Yes, there's a trunk component that they would put, and also we teach them for the upper body, like manual lymph drainage, that they would do that before they'd put the pump on to clear.
So this is not a one-size-fits-all type? It has to be custom made for the individual?
Well, there's different types of sleeves sizing, of course,
okay.
But yes, those, like I said, our consultants, they will come out to the home and they'll measure the patient, and then they'll actually do a trial and place the pump on the patient and see how the patient can, experience that and see what they think of it as well.
I can get an impression that certain patients might, if they have difficulty, I don't know if lymphedema has an age issue, but I can picture maybe an older person that might have bad arthritis. Maybe a pump like that might be helpful if they have very difficult ambulation in their hands,
or they're unable to reach their feet.
Yeah, I mean, I can see how something like that might be advantageous. So that's nice that there's another option.
Sure.
But so,
well, how about? Tell us about the changes in kinds of treatment that we've just had. Maybe how long have we been knowing about this disease, and how long have we been knowing how to at least do what we're doing today, or what you folks are doing today?
Right. It was in the late 80s that the technique was brought over here, and it's definitely, obviously, like I said, we're now using these reduction garments.
Now, when you say brought over here, from
as far as Europe and everything, it was more. That's where it was more.
So there's more of these types of disorders over there, or they're just more progressive?
Well, the founders, it was more European technique. So as it brought to the United States, the doctors found it out and brought it here, and then as far as, like I said, our different things have definitely evolved, where we use these compression bandaging, bulky, multiple layers of bandaging, and now we're using these reduction garments, and just much more freer per se for the patients to be using. And
okay, folks, you're listening to Health Matters with the Medicine Center Pharmacy.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, this is Brad White from the Medicine Center Pharmacy. Do you feel stressed and tired? Do you rely on caffeine, crave salty snacks, have mid-afternoon lows, and can't bounce back? These may be signs of adrenal fatigue. The Medicine Center Pharmacy offers easy saliva cortisol testing and nutritional supplements to help you get your energy back. Talk to your Medicine Center pharmacist and see if cortisol testing is right for you. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
That's right. This is Paul White, and the Half Off on Hot Buy store is your cold weather source. Women's WinterTech gear boots are only $6.95. Fashion boots are marked down to $9.99. Retail value up to $60. And hats and gloves are on sale, too. New in the store are American greeting cards. 2 for 99 cents. Regular price at $4 each. Also, for snow shovels to floor mats, stop in the Half Off on Hot Buy store. Find the best deals in town.
Hi, this is JP, and I'm here with my grandpa talking about the amazing deals at the Half Off and Hot Buy store in Louisville. Visit our website at halfoffhotbuys.com and check us out on Facebook, too.
Hi, Paul White for the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Do you know that we partner with Mercy Medical Center to provide low-cost blood screenings in our pharmacies? You can choose from the following screenings: thyroid for $5, lipid profile for $8, total cholesterol for $2, glucose for $2, and A1C for $10. These are the same tests you would receive from your physician. Please give us a call at 330-454-8772 for dates and locations. Come see us at your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're talking about lymphedema with Jonas Sykes, Physical Therapy Director, and Jeannie Lee, Certified Lymphedema Therapist and Occupational Therapy Assistant at the Aultman Lymphedema Management Clinic. Our final portion of the show is now here. So, you mentioned before that March is Lymphedema Awareness Month. Tell us about that.
Yes, sir. So 2018 marks the 29th Lymphedema Awareness Month, and March 6th is the official Lymphedema Awareness Day. So since we're talking about this condition that's not so well known, we're just hoping to bring awareness that there's, Medicare does not cover the most critical part of the treatment this applies. So as far as there's a act, the Lymphedema Treatment Act, which they're trying to get passed, and in hopes that then, of course, other insurance would follow Medicare guidelines as well.
So does any insurance cover like the sleeves or any that sort of thing?
Yes, we are finding a lot of the private insurances do, exception with Medicare. It's very difficult. A lot of
So does Medicare ever cover it? Would they ever cover it? Any of the things?
We've had very few.
Okay.
Yes. And that's women with breast cancer diagnosis and obviously lymphedema resulting from that condition. So that's why we're trying to hopefully get this Lymphedema Treatment Act passed. And it was introduced in Congress in 2010, and we're still fighting for it.
And with prevention being so important, it really is a money saver for Medicare in the sense that if you can prevent infections and ER trips by just paying for some supplies, it really in the long run is advantageous.
Well, and in our environment, at least on the pharmacy side, it seems like many private insurances follow Medicare guidelines, so if Medicare doesn't cover it, then they don't either, just because they feel like Medicare is the gold standard.
Correct.
So I can see how it'd be really important for patients to get preventative maintenance treatment. So
I kind of read this as really an expensive disorder. I mean, if hardly any insurance is out there, what could a patient expect to expend in a year? I mean, what's 10,000, 20?
Well, it depends on if the patient is a custom garment where, it's, and then there's off-the-shelf garments. Of course, those are obviously cheaper.
Yeah, sure.
But, custom garments can $500, and those generally $500 to $800, some depending if both legs, then you're talking a couple $1,000s, and that could last 6 months and then needs to be replaced.
And you say custom, and I just want to clarify, it's not because it has to be made to fit your particular condition.
Correct.
You just can't go in and buy your size 10 Nikes.
Right.
It doesn't work that way.
Right, because
So.
some people obviously have more, as they reduce, they have more, quote, normal body shapes, and others, there's all different sizes, plus sizes that don't necessarily fit the guidelines for these off-the-shelf garments, so then they become custom garments.
But the good news is most insurance companies cover therapy, and this is, they're treating under occupational therapy, so you can at least get in and you can get the consultation and get the treatment options there, and then make a better decision on how to proceed.
Right, and the patients can certainly advocate for themselves with their insurance companies, with the doctors, to get the doctors to write a note and letter of medical necessity, and it's a process, of course.
It is a process, and I never wanted myself to be terribly politically active, but I find myself weekly contacting our elected officials on different healthcare topics, and I guess this is a new one to add to the list, because it sounds like a lot of patients could really benefit.
Right.
So if you get the lymphedema thing passed after how many years this is going on, I mean, what are you expecting to get out of this? Like coverage, Medicare coverage? Are there other aspects of this bill, or just are you focusing on Medicare?
It's definitely focused on Medicare because, like we said, they're considered the gold standard or the guidelines, but it's really for the supplies to be covered.
Sure.
And that's the big part of this, obviously, for patients to be more compliant.
So the patient would come to you daily, weekly, every week?
So 3 times a week, and generally, and then we can bump it down as they become more. Like I said, with these reduction garments, sometimes we can teach them to take them off, and and it's definitely.
Can they, if it was, say, conveniently like some area in the body, can they do the massage themselves without garments, or?
Well, you generally do. Yes, you always do the massage without skin-to-skin contact, and then we would teach the patients to do like a modified or self-massage technique.
So the skin isn't necessarily debilitated, or yes,
well,
no.
As the condition progresses, like we talked about, the proteins become more hardened, and the skin it looks like the stage elephantiasis. It can look very tough, but it actually is very fragile, and definitely.
So the skin gets more fragile.
It can be more open with wounds.
Okay, so I had an aunt who was one of the first people on steroids in the 50s, and they overdosed her dramatically because they didn't know what the heck was going on with them in 1951, 2, and 3. And so as she aged, her skin got to be like toilet tissue, and she ended up in a nursing home in her later years, and every once in a while a healthcare worker would grab her and would tear her skin right off.
Right.
Would they get to that?
Not different, a little bit different than that. However, it's more hardened, but the skin, it definitely can have the proteins, like I said, are pushing out, then become the wounds, and so it definitely is more fragile in appearance as well.
So, what's the status of the bill now? Do we have any idea?
Well, it's still active.
I mean, we've had new Congresses and
right.
2 or 3 at least in that time frame.
Yeah, it's still active in the current 115th Congress, which is running from the beginning of last year through the end of this year. Everyone, we welcome them to go to the www.lymphedematreatmentact.org, and there's definitely helpful links to email Congress, call your senators, call your House reps, get involved, especially if you or someone you love obviously has lymphedema. They're a very good resource for that, for avocation.
Do children get this?
Certainly can. They certainly can.
As young as?
Well, we've personally not, but as far as in our course, we've young children, babies. I mean, it's very, it just depends on how their lymph system is formed.
We've even seen congenital with twins.
Right. We've had a brother and sister, and and they were in their late teens. And I remember the patient. She told me she was in her, she was 2 years old, and the doctor told her mom, "Hey, just elevate that leg." Well, a 2-year-old, how can you elevate the leg? And so, all through life, gymnastics, swimming, that was out because she was very, very.
Well, very interesting, folks. We're out of time. How about that? Thank you to our guests, Jonas Sykes, Director of Physical Therapy, and Jeannie Lee certified lymphedema therapist and occupational therapy assistant at Aultman Lymphedema Management Clinic. We'd like to remind our listeners, if you suspect you have a medical issue, make sure you contact your healthcare provider. Stay in touch. Thanks to our sponsors, Studio Arts and Glass, Kempthorne Motors, Kiko Auctioneers, and of course our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. Stay out of the snow, and we'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.